You and Your Health with Dr. Richard Okoye.
Hello, my pleasure and my honor coming your way in this wonderful edition of You and Your Health, brought to you by Drsavealife Foundation. I'm Dr. Richard Okoye. We have a very, very awesome time to be able just to take our vision to the next level. And what is this our vision? Our vision is Operation 2025. It's unfortunate that Nigerian life expectancy is seated in an awkward position of 55 years. After that evaluation in the United States, I came back and I said, no, it is possible that Nigerian life expectancy, by reason of some of the fundamentals we've been able to observe, that Nigerian life expectancy could move from 55 years to 70 years by the year 2025. We asked a question today, and that very question is, why is it that we do not have cancer survivor here in this side of the world? Why is prostate cancer so common among men? Why is the benign prostatic hypertrophy? What are the things that can help out? And I will tell you, there are a lot of prostate cancer survival all over the world. Do you know a man, of course, our own man, Nelson Mandela? Nelson Mandela was diagnosed of prostate cancer at the age of 83. He died 95, cancer-free. Archbishop Desmond Tutu, also of South Africa, he had prostate cancer, living cancer-free. Emperor Akihito of Japan also had prostate cancer. He stepped aside, cancer-free. Of course, you also remember the former US President, Ronald Reagan. And you know him, he suffered prostate cancer. He also died cancer-free. The former US Chief of Staff, Colin Powell, also suffered. But they live cancer-free. How did it happen? Why is it that in our own, they say this person have prostate cancer, death sentence, breast cancer, death sentence, cervical cancer, death sentence, intestinal cancer, death sentence? But I tell you, all these cancers today can be cured. What could be the difference between us here having prostate cancer, them in South Africa, and also them over there in US and Europe? The difference is not in infrastructure. It will amaze you. It is not in infrastructure at all. The fact remains, early diagnosis of any medical condition, including cancer, is as good as prevention. Should I say it again? Early diagnosis of any medical condition, including cancer, is as good as prevention. Good news that will actually sound to you. And why is it that our people don't have that privilege? This is where it began.
You and Your Health with Dr. Richard Okoye.
Now I have the opportunity to tell you the genesis of our healthcare crisis. Forget about infrastructure, because that is basically what we do have as our mindset. Oh, the infrastructural difference is important. But I will tell you, you are the first person first. But who you need to be informed before you can have an informed decision. So on the basis of that, medical information, unfortunately, has been coming to people in an ambiguous terminology. That is the beauty of what you are going to receive when it has to do with you and your health, delivered by Drsavealife Foundation in this station. It comes in big grammar. And by reason of coming with the big grammar, many people do not know, irrespective, hear me and hear me well, irrespective of someone's status in any profession. If the fellow does not go through medical school, there are so many things I can tell you the person is ignorant. It is not even a respecter of title. A professor not too long ago had prostate enlargement. He has friends in the university teaching hospital, and they told him, you have to take this other drug or ultimately you will go ahead and do operation. But unfortunately, because of the information, not a respecter of title, A fellow said, no, there's one product that if you take this very product and take it, it will dissolve the prostate. He failed to realize that whatever could dissolve the prostate could have a tendency of dissolving the kidney. He took that and had kidney failure. From kidney failure, they took him up and down over the time of dialysis. He's in the grave. It's so touching. Because this is a man that's supposed to be right here, communicating. Because intellectual knowledge is not something that is transferable. And that's why we have to protect it. And the only way for you to protect that you think you know is by being healthy. What is most important is not about facility, but it's about early dictation. Early dictation. There's a very serious problem among our people, which COVID has been able to give us a wakening call. In as much as you have been around, you've been going to work, you drive your car and all that. Can I ask you this very simple question? When last did you go for health check? Just cast your mind a little back. When did you go for health check the last? No, God will take care. If you have money, you buy car, you buy land, you can even kill yourself because you're for a property. But when it comes to your health, you pray. You transfer the responsibility to God. That even for you to spend money for your own health, it will be paining you. That is the wickedness that Satan, as it were, has been able to do to blind our mind towards what is most important. Jesus made a statement. He said, beware of covetousness, acquisition of this, that. For a man's health, life cannot be compared to the abundance of things he possesses. Have you seen where they are burying people? Notable people, people that are of prominence. You find that everything that is called theirs remains here while they are gone. That thing that you call your own property, my, hold me, their whole is all dependent on this very body that is driving you to your destiny. Attention to be given to it is now. Attention to be given is now. At what point have you gone to be in position? Can I have a health check? Hear me. Aging without going for a health check could be likened to driving a car without dashboard. When the oil is finishing, you are not aware. Come on. When there is no water, you are not aware. And that's why at the point of presentation of our people to the hospital, the worst had already gone. That's why if you can capture any disease, including cancer at the early stage, it could be taken off. That's one of the things we're going to talk today when it has to do with prostate. Early dictation is as good as prevention. But once cancer has undergone metastasis, the prognosis is a function of when they say that how many years left. Not issue of cure, but how many days could this very person be able to live on earth? We don't have to drive our vehicle, our body, which is our vehicle. We don't have to drive it to that point of knocking. If you don't be in position to service your health, it may knock before the time. So when you are hearing people are having stroke, they are having cardiac arrest, they are having the issue of this cancer and they say it has metastasized. A woman will have breast cancer and we keep a breast, he knows that it's already undergoing decay. He will pad it, use perfume and just carry it along. The time is now. Your health should be given priority. Our Ministry of Health should be given priority. Our health institutions should be given priority. That is the fundamental thing that you see why our healthcare system is different from the other people. Because what you do not give a value, you then spend for it. So I want us to go at this point to look at one out of all, the issue that has to do with prostate. and how it has limited so many men. Is there any hope even this prostate enlargement on the issue of prostate cancer? Stay tuned.
Today I can breastfeed.
I never dreamt in my life to be in India, neither enter plane before I died at the age of 70. My vote of thanks to Dr. Drsavealife. I'm very happy with them. They've not revived my life again, no matter the age. Now I feel I can live a little longer than I could have lived.
You and Your Health with Dr. Richard Okoye.
Welcome back. You are still on You and Your Health, a program sponsored by Dr. Drsavealife Foundation, a non-governmental organization with a clear vision of revolutionizing healthcare delivery to the people of Africa through the power of knowledge. We have a vision of moving Nigeria life expectancy from 55 years to 70 years by the year 2025. It sounds unrealistic, but I tell you, it is fully achievable. By the grace of God, I have a software company in the United States, and we have developed an app called Dr. Drsavealife. It's gonna change everything about healthcare very soon, particularly as regards to your health. I encourage you to be part of this very mission as we make this journey across Africa. Right now, we're going to look at one subject, particularly what has affected so many men. They call it prostate-related problem. What is actually this very prostate-related problem? You know, so many people will just, when I say you have prostate problem, you panic. Nothing to panic. I will tell you what and what you need to know about it. Number one is that prostate is normal. As a matter of fact, your prostate is important even in your reproduction because it produces about 20% of the semen, what you ejaculate as a man. 20% of that fluid comes from the prostate. All right? Now, let's be in position to have a better understanding of this particular prostate. If you have a look at this, all right, to help you understand the subject of prostate and prostate-related problem, you need to look into the uroreproductive axis of a man. What implies that what you see here is what is called the bladder. As a matter of fact, this is actually slice the body into half in order to enable you to see the section of it. Do you understand? So this is the bladder, all right, and the urine will come from the kidney and go into this very bladder, and you can see a pathway of this very bladder coming down, and that very pipe called the urethra will continue, and the man will urinate it out, okay, when he's pressed. In other words, the urine gets to the bladder, goes out through the penis, okay, but through the urethra, the pipe orifice. Now, there's something I want you to observe here. If you look critically here, let me just be in position to get this very beautifully fine. Okay, if you have a look at this, this is the bladder as earlier stated. You find that there's a pipe that goes out to take the urine out, but at the neck of this very bladder, you have this apple-like structure. You know the way you just slice apple into two, all right? You can see this very apple clamping, or as if it's, you know, clamping over that particular pipe. This is what is called prostate. This particular very one is what is called the prostate, okay? I want you just to have a very clear picture of it, because that's all the problems of prostate is all related to what I'm going to tell you right now. Now, this is normal. The road is free. There's no problem in urinating and everything. But from the age of 50 and above, there happen to be not properly understood what could lead to the enlargement of the prostate, and they call it benign prostatic hypertrophy. That benign meaning that not cancerous, all right? It gets enlarged. It could enlarge outside, it could also enlarge inside, but I will tell you the implication. So what happened is that When this prostate gets enlarged, because it's getting enlarged right now, it will now start tapping on the wall of this particular bladder, causing some level of irritation. So that irritation it will cause on this very bladder wall will make the person feel as though he want to go to urinate. So it may give one symptom that is called frequency. What is frequency? This very fellow will be as if he just want to go to, he want to go and urinate, and interestingly sometimes it may be associated with what is called urgency. Urgency that if he doesn't go, he says, no, you will just pour. You know that kind of a thing? Right. This is one. That's why so many people, non-diabetic as it were, will suddenly start urinating frequently. Some people can urinate as much as 10 times at night. 10 times. And one of the things is that when they want to go and urinate, they will be feeling as if there are so many urine right there. But when he goes, he will just empty a little thing because of that very irritation. So this irritation following this enlargement of the prostate will give birth to what is called frequency, and also give birth to what? Urgency. You want to frequently go to urinate. You want to just, if you need to urinate. You appreciate that? All right. So, be that as it may, we need to establish at this very point in time, not that anybody who urinate frequently, like this from the age of 50, is most likely to be prostate. No. You almost have to also eliminate other causes of frequent urination, like diabetes, both diabetes insipidus and diabetes mellitus. You also need to be sure that there's no urinary tract infection, because sometimes you can also give birth to such frequency, or also prostatitis, inflammation of this prostate. Sometimes it can also give birth to that very frequency. But we are talking about prostate enlargement. Now, this what has happened. We have now frequency established. Also, we have urgency established. After this, many men get concerned about this one, okay? But after the expansion continue, don't forget that this particular pipe could be likened to that very pipe, used to, water the flower and all that. Which most times, if you press it from outside, it will narrow the rate of water flowing, all right? So what happens is that as this starts enlarging and suddenly enlarging towards the inside, it will start closing this very hole. You get that? When it starts closing this very hole, it will now lead to what is called retention. But don't forget that what is so unique about a man is that when a man urinates, the urine tends to thrust forward because it comes out with pressure, all right? But when there become a narrowing of this very pipe, it is called that the man will go right there. The pressure is no longer the way it used to be. I tell you a very interesting experience that we had when we were in school, primary school precisely. It happened that we were putting up an argument that whatever a man can do, woman can also do. It was quite hot. Of course, that is the current debate in the world today. Whatever a man can do, woman can do. And as this argument was getting hot, one young boy, I don't know what came over him, he got provoked. You know what? He went to the field and drew a line and crossed over the line, zipped down his shirt, and over the line, he brought out and urinated across the line. And said that if what a man can do, woman can do it also. Let a woman stand over the line and also urinate across the line. That is how we won the debate. So a man has the ability in him to be able to urinate, and the urine will go up. All right? But that is what will be limited by the issue of prostate enlargement. This very narrowing, as you are seeing now, will give birth to poor urine flow. All right? So from that very poor urine flow, it will give rise to what is called retention. Let me tell you what this retention is. Majority of them will feel as if they want to go and urinate, all right? Or they are pressed. But then we get there and still... Don't mind me, that's exactly what happened over there because they are my friends. So after staying there after a while, he will feel that Then the urine come out, the urine is not coming. So after waiting for a while, he will carry half tank. He knows that you are urinated, but some are still there. But since he's not coming out, he will carry the half tank and go. After a while again, he will come back with the half tank and stay again. After a while, he goes. So he will be in position to go that over and over and over again. It's quite a very, very frustrating situation. So when you have this kind of scenario, over time, maybe in one of the quiet nights, unfortunately it usually happens at night, this particular pipe will become completely blocked. And when this line, when this pipe get blocked, what will happen at this particular point in time? The man will be shouting, he couldn't urinate, he couldn't urinate. And what will be done at that point, it becomes an emergency. And when it becomes an emergency, we rush into the hospital. To relieve him of that pressure at that point, the hospital have to now pass pipe, what is called catheter, right into the bladder from the mouth of the penis. From this very mouth, the catheter will go in and pass that obstacle and be able to get here. And the person will now start urinating. That's why you see a number of men carrying catheter, all right? But is that the solution? Is there any complication following this condition? And what is the solution to this problem? When there is a narrowing of this very pipe, as Ella showed you, that particular pipe, once it's narrowed, what it means that every urine coming from the up there will not be in position to flow freely. You understand what I mean? It will not be able to flow freely. And because it will not be able to flow freely, the tendency of having what is called kidney stone, bladder stone, and also the chances of over the time of staying the urine overstaying in the bladder, it may have what is called urinary tract infection. So that's why some of them also have problem of pain during urination. And if that goes into ascending order, whereby you have to meet the kidney, you may have what is called hydronephrosis, enlargement of the kidney, and also some other infection, pyelonephritis and other. So it is important that when you have a problem of prostate, you need to give it attention. Now, is there any treatment for benign prostatic hypertrophy? Yes. As a matter of fact, there is no room for you to be in position to be carrying those catheters anymore, because most of the drugs group under what is called alpha blockers. Those drugs, a number of them are there, right there branded, that you also could be in position to use to help her. But the honest truth is that if this persists, it's no longer a problem for you to be in position to cry. Within a space of an hour, 45 minutes, maximum of 2 hours, a person that can do what is called laser prostatectomy, or you can even do the one that is called transurethral resection of the prostate, whereby a camera could be in position to go through the mouth of the penis and just get there to be in position to dislodge that obstruction, and the person will be able to be urinating again. Most times it doesn't require more than 24 hours to 48 hours hospital admission. I have a picture of that to show you. This is what is called laser prostatectomy, that will be in position to go and by reason of laser fiber in a couple of hours be able just to take it off, and this little fellow could be in position to be urinating. Now going to the one that is most important to us, which is issue of prostate cancer, unfortunately becoming common this time. You know what? Prostate cancer can be cured. I've mentioned a number of them today that are living cancer free, so you shouldn't be in position to panic you. But most importantly, from the age of 50, routinely do what is called PSA, prostate specific antigen. It's just something that a simple test you can be in position to do. If that prostate specific antigen PSA showed any element of elevation, don't panic, because sometimes you could be in position to have what is called false positive, but you can repeat it again. But if it persistently show that the thing is increasing, not still a provision for you to panic, then at that point you will do what is called prostate biopsy. They will through the anus, because the anus is very close towards the prostate, and pick up a particular portion of that prostate and check. If it is prostate cancer picked up at the early stages, there are a number of options, including radical prostatectomy. That, the prostate is a slow-growing tumor. The prostate cancer is a slow-growing tumor. So it usually starts from the posterior wall. That's why anal examination, you can feel a hard mass about that as it. Be that as it may, if it is at that early stage of it, if you do even a radical removal of that very prostate, you may also cure the prostate cancer there. Because at that point, it has not undergone metastasis going to the bone, causing waist pain and causing some other things. If somebody has a prostate cancer, most times there will be no symptoms, but sometimes they also urinate blood. But you must not wait for the urination of blood before you say, oh, I have prostate cancer. No, early dictation. Your PSA can be in position to reveal a lot in that particular direction. All right. And also, when someone is urinating blood, it may not necessarily even come from prostate. It may be from a stone. It may also be from bladder cancer or bladder tumor. So all those things are why it is essential that you take out time to do complete health evaluation. Educate people from what you have gotten today. And together, we will be able to build a very healthy family and also a healthy nation. Join us in Vision 2025. Nigeria will experience a life expectancy of minimum 70 years. It is doable. See you again.
You and Your Health with Dr. Richard Okoye is brought to you by Drsavealife Foundation.